Good morning, everyone. My name is Marlene Castillo. I am the Community Development here at Mexican. It is a pleasure to have you all here with us this morning. So I am going to go into our presentation. So for those of you who are new, our mission is to be the voice of the community and advocate across different sectors in North Carolina. We have three main goals: disciplinary, focused on Latino and marginalized issues, to intensively collaborate with community partners, community members, and federal and state representatives to educate the communities on resources and any up-to-date news. And lastly, to engage in our role as leaders and have consistency in our work. This morning, we do have the pleasure of having Eminent G. She is a PhD, MPH, and the Senior Strategic Advisor at the Healthcare Equity at Blue Cross Blue Shield of North Carolina. In this role, she supports initiatives that utilize data to understand and address health disparities. Before joining Blue Cross NC, Ms. Eminent worked in various healthcare settings, including developing and managing community health programs, working with providers on quality improvement initiatives, and serving as director of grant making for a foundation focused on health equity. So with that, I would like to introduce Ms. Eminent to the group, and I will hand it over to you. And if I need to make anybody else co-host, please let me know. And thank you guys for joining us again this morning. If you do have any questions or comments, be sure to enter those in the chat box. And thank you.
Thank you so much. It's a pleasure to be here. Again, my name is Emnet, and I'm happy to join this meeting today to talk to you about some of our the work that we've been doing in healthcare equity at Blue Cross NC. I also have some of my other colleagues on the call. I just wanted to take a moment to have them introduce themselves. Dawn, can I start with you?
Oh, absolutely. Try to get more than my forehead. Hi there, Dawn Porter. I'm the manager of health equity at Blue Cross and Blue Shield of North Carolina. It's fairly new, say within the past 2 to 3 years of a formal area to address disparities, but we've been talking about it for a long time. So thankful that we're at the point we're at. We've got a good team with us, and proud partnership with our other areas of within Blue Cross as well, including community and Leo, who brought us here. So I am going to pass it over to Paula.
Hello, everyone. Paula Austin. I'm actually a program manager, and I work more in the federal employees health benefits space. I'm glad to be here today and look forward to more conversation. Thank you.
Leo, would you like to jump in here?
Oh, I wasn't planning on it, but thank you, Eminette. Leo Scarpati with Blue Cross Blue Shield, community engagement under our corporate social responsibility. It's good to see so many familiar names on the call, and I hope you find the information that Eminette's going to share helpful.
Thanks. Bradley?
Good morning, everybody. My name is Bradley Yelvington. I'm also a program manager like Paula. I work in the commercial space in the care management and population health area of our company. I focus a lot of my work on preventive care, and so interested in hearing the presentation and happy to be here. Thanks a minute.
Thank you. And Becca.
Hi everyone, my name is Becca DeSema and I'm a health equity strategy intern this summer, so I'm fairly new, but I'm really excited for this presentation. I'm really getting excited to get to know you guys.
Thank you. I think that's all from the Blue Cross side. So I'll go ahead and share my screen. Let's see. All right. Can everyone see my screen okay?
Yes.
Yes, okay, cool. So we are here to talk to you about our first ever health equity assessment. And this presentation in particular will focus on the Hispanic Latino, some of the Hispanic Latino member disparities that we shared or that we saw. We shared this presentation with Leo, and he mentioned that you might be interested in hearing more about it. And frankly, we are really interested in your reactions and your recommendations. So we're looking forward to the conversation that follows as well. So we like to start with our purpose. Our purpose here at Blue Cross North Carolina is to improve the health and well-being of our customers and communities. We say we won't stop until healthcare is better for all. And we know that that for all part is really critical for our health equity strategy. And as Dawn mentioned, we're a relatively new team, the healthcare equity strategy team at Blue Cross. And this has been one of the first things that we've done is the assessment to really inform our strategy, to inform our partnerships internally with other departments to start to address some of these disparities, and also for our strategy to partner with others in the community to start to address some of these disparities. So the health equity assessment, like I mentioned, is our first ever health equity assessment that we've undertaken. And this is something that we're going to be, we're planning to continue to do every year to look at our data to identify disparities by race and by ethnicity. Today, we'll talk about the overall findings as well as the specifics by our lines of business, you know, the type of insurance that people have, whether it's ACA or commercial, as in people insured by their employer, or state groups, student groups, the federal employee program, Medicare Advantage. So we've looked at the data overall, but also broken it down by these specifics, by these lines of business, to see if we can pinpoint where we're seeing some of these disparities and if we could develop strategies to address them. We looked at a few measures for this first assessment, and I've listed them here. Colorectal cancer screening, so that's looking at, of all the people that should get a colorectal cancer screening, where it's recommended from ages 51 to 76, what percent of them have gotten that screening? Controlling high blood pressure, of all our members that we know of that have hypertension, what percent of them have their blood pressure under control? Similar for diabetes, of all our members that we know have diabetes, what percent of them have their blood sugar under control? Follow-up after mental health hospitalization is if a member has been hospitalized for a mental health concern, did a follow-up happen after they were discharged or after that hospitalization? And this particular measure is, did a follow-up happen within 7 days? Immunization for adolescents, and then prenatal care and postpartum care timeliness. For prenatal care timeliness, we're talking about whether a pregnant member had a prenatal care visit within the first trimester of their pregnancy or within 42 days of being enrolled in our plan. And postpartum care is essentially whether the member had a visit in the postpartum period from like 7 days to 84 days postpartum after delivery. So essentially within like the first 3 months after delivery, did they have a visit? And we looked at data from claims, from medical claims that we received. This is data from 2022 through the beginning of 2023. And we will be, again, like I said, this was our first assessment. We'll be doing this assessment again this summer, looking at 2023 data, but this is the data, the analysis we have to date. So we took the claims data that showed us, you know, the rates on those measures that we talked about. And then we married that up with race and ethnicity data we have. For today's presentation, we're just focusing on the ethnicity data. We have some self-reported ethnicity data from various sources. We also have, whenever we don't have self-reported or member-reported ethnicity data, we've imputed it or inferred it from other data sources like Experian. In this case, we use Experian data. We're working to increase the amount of self or member reported data we have, but at this point we're using what we have and then filling in with any other data that we can find that we can be fairly confident in. For this analysis, we excluded any subgroups that had fewer than 30, which is pretty typical for these types of analysis. And we also, when we were looking at the differences between groups, we did some statistical significance testing to check whether the differences we were seeing were statistically significant and weren't just due to, you know, chance. We also supplemented the quantitative data with qualitative data from focus groups with members. We know that quantitative data, while useful, cannot tell us everything. So we looked at some of the qualitative data, and we'll be talking about some of those findings as well. For this presentation, we're highlighting opportunities that we saw to close disparities based on what were statistically significant results for Hispanic Latino members compared to non-Hispanic Latino members. So our overall findings, and there's a lot of data on this slide, so this is, you know, I'm not going to go into much detail here, but this is just to give you sort of an idea of the pattern that we saw overall. So overall, for almost all the measures that we looked at, non-Hispanic or non-Latino members had a higher rate compared to Hispanic or Latino members. And all of these differences were significant. The only exception is the immunization for adolescents, where Hispanic or Latino members had a higher rate compared to non-Hispanic and non-Latino members. Some of our greatest opportunities just overall are for blood sugar control, for prenatal care timeliness, for controlling high blood pressure, and for colorectal cancer screening. And this is overall not looking into the specific lines of business. So digging a little bit deeper, I'm gonna go into, was there a question?
Yes. Is there any
Somebody
chance
come
we
off
could
mute.
enter full screen mode so we can see the screen a little better?
Oh, yes, I'm sorry. Let me, sorry, I have like these things in the way. Okay, is that better?
That's perfect. Thank you.
Little bit? Okay. So I'm gonna go into the details by line of business. So for commercial, which is again, like employee sponsored health plan, state health plan, student health plans, the commercial results largely mirrored the overall results that I was showing just now. So the opportunity there was essentially to improve all of the measures that we looked at for Hispanic Latino members, with the exception of the adolescent immunization combo 2, which was the only measure where Hispanic Latino members had higher rates than non-Hispanic Latino. And these are the, going deeper by measure for colorectal cancer screening, the rates for Hispanic members were 54%. So 54% of commercial members who identified or were identified as Hispanic Latino had the recommended colorectal cancer screening compared to 76% for non-Hispanic Latino members. So we see an opportunity there. We also looked at the data regionally, and overall, if we weren't looking at, at this by ethnicity, our overall opportunity is greatest in Asheville, but for Hispanic Latino members, for this particular measure for colorectal cancer screening, the Wilmington region had the greatest opportunity for closing that disparity gap. Moving on to blood sugar control. This was, of all the measures we looked at, this had the greatest opportunity for closing that disparity gap, with 23% Hispanic commercial members having, Hispanic Latino commercial members having, and these are members who already have been identified as having diabetes, having that blood sugar under control compared to 48% for non-Hispanic, non-Latino. And then digging deeper again, regionally, we see this, the greatest opportunity in the Triad region, where, the Hispanic Latino versus non-Hispanic Latino gap was the biggest. For controlling high blood pressure, again, there's a different, there's a 36% rate for Hispanic Latino members, compared to 59, almost 60% for non-Hispanic Latino. And this is again for members with hypertension, is their blood pressure under control. And in this case, we saw that the greatest disparity for Hispanic members was in the Wilmington region. The Eastern region was the only one where the Hispanic Latino member rate for blood pressure control was higher than the one for non-Hispanic, non-Latino members. And I should have said this at the beginning, but the reason that we're presenting all of this, including the regional data to you, is because we know, as people who are closest to the members that we're talking about here, you may have a sense of, the reason behind why we're seeing some of these patterns and some of these rates, and also the reason potentially behind the regional differences that we see. So we would love to dig deeper into some of these findings in the discussion portion of the presentation. For prenatal care timeliness, about 44% of Hispanic Latino members who were pregnant and who had commercial insurance had their prenatal care timeliness or their prenatal care visit within the first trimester, compared to 71% for non-Hispanic, non-Latino members. And this disparity was greatest in the Asheville region. And for postpartum, the rate was 68% for Hispanic, so 68% of Hispanic Latino members had their postpartum care visit within 7 to 84 days after delivery, compared to 77% of non-Hispanic, non-Latino members. And the greatest disparity for this measure was in the Charlotte region. Follow-up after mental health hospitalization. This is 7-day follow-up. The commercial line of business was the only one where we saw this measure have a significant disparity. So in this case, Hispanic Latino members, about 25%, the rate of follow-up was 25% compared to 43% for non-Hispanic, non-Latino members. And we dug into this a little bit deeper in the focus group. So we'll talk more about there are some of the reasons behind this, specifically for potentially for Hispanic Latino members. And now the ACA line of business, which is people who are buying their insurance through the marketplace. So there's an opportunity there to improve the rate for Hispanic Latino members in colorectal cancer screening. And that was where we saw significant disparities here. And we also, the trend that we saw with adolescent immunization rates overall, where Hispanic Latino members had a higher rate compared to non-Hispanic Latino, that trend holds true for our ACA membership as well. Here's the difference between Hispanic Latino and non-Hispanic, non-Latino members for colorectal cancer screening. Not as wide as the rates that we saw for commercial, but still the disparity is there. And when we look at it by region, we see that the disparity is greatest in the Eastern region. For the federal employee program, there we saw opportunities to improve the rates for colorectal cancer screening, controlling blood pressure, and getting blood sugar under control for Hispanic Latino members. These are the rates for colorectal, 76% compared to 88%. And we couldn't look at these data by region because the numbers that we have got so small that we couldn't really break them down by region. This was not a concern when we were looking at the commercial data. Those data points are, representing members like in the hundreds of thousands for some of these measures. So it wasn't a concern for our commercial analysis, but we couldn't really look at it by region for the federal employee program. For hemoglobin A1C or blood sugar control, we saw 47% for Hispanic Latino members compared to 65%. And then for controlling blood pressure, the difference was 55% compared to 78%. I talked about how, we have the quantitative data, but no matter, really we know that we could look at the quantitative data all day, but it will never tell us why people are not getting their colorectal cancer screening or why they're not getting their prenatal care in a timely manner. So it was really important to us to hear from members about some of the reasons behind the data, the quantitative data that we were seeing. So we conducted focus groups with members, and we specifically had a focus group that was dedicated to Spanish-speaking members. Some of what they told us is represented in this slide. So overall, we heard that cost, awareness of benefits, understanding of benefits, and transportation are some of the most common barriers to receiving healthcare services. I highlighted some of the points that really stood out in the Spanish-speaking focus group. So when it comes to barriers to primary care, not fully understanding insurance coverage, this was a concern for all groups. Every single focus group that we had, Spanish-speaking, English-speaking, rural, urban, all of them had concerns around not really understanding what's covered, what's not covered, and this was a barrier to seeking primary care. We also saw some, we also heard some barriers around, I don't need to go to the doctor unless I'm sick. And in the Spanish speaking focus group in particular, there was some discussion of, really before I came to the United States, I would only go to the doctor if I had a problem, and that worked for me. I could get an appointment when I needed it. So why do I need to go to the doctor when I'm not sick? Language was a barrier that was cited, as well as just cultural barriers, kind of perceiving that the provider didn't understand some of the cultural nuances of what patients valued or didn't. There were also barriers to getting, we asked specifically about what are some barriers to getting preventive screenings like colorectal cancer screening, and lack of awareness and education about who needs to do these screenings, by when, and what age, will the insurance pay for it? All of those were barriers that we heard about. Also barriers to chronic disease management. So barriers around getting diabetes or blood sugar under control for patients with diabetes, and also hypertension. We heard, it's related to the barriers to primary care, lack of a PCP, lack of information, mistrust of doctors was another issue that came up. Limited availability of community clinics that were more trusted by the community. And then some members also cited less healthy cultural or dietary practices that may be contributing to some of these challenges when it comes to chronic disease management. Barriers to maternal care, as you saw in the data, prenatal care timeliness, postnatal care timeliness were both measures where we saw significant disparities. And really all of these, lack of transportation, lack of childcare, lack of available appointments, lack of emotional support, all of these were cited across the board, but lack of trust in healthcare providers was specifically mentioned in the Spanish-speaking focus group, as well as in we had another focus group that was for people of color, and that was mentioned there also. And then we also asked about barriers to mental health care, because we saw in the quantitative data that I shared, follow-up after mental health hospitalization is an opportunity to, there's an opportunity to improve and to close gaps, to close disparities in that measure. So when it comes to seeking mental health care, really no surprises here, but cost, insurance barriers, difficulty finding a therapist, stigma were called out in all of the focus groups, but specifically in the Hispanic Latino focus group, or the Spanish speaking focus group, there were some that cited that there were very cultural biases against therapy, that just not wanting to be perceived as someone who would need that kind of care, which isn't commonly culturally accepted in some of these cultures, was a barrier that was mentioned. So like I said, this is really, this is us starting the conversation, but we really would love to hear from you. Did the findings surprise you? Did they affirm what you already knew? We see you really as the people that are in the community, that are of the community, that would be able to add to the depth of these insights. And we also would love to hear about, if you've worked on some of these, priorities that we've identified, like screenings, or even primary care, or chronic disease management. What are some effective strategies that you found to address these disparities in these communities that you work with. And then any questions or recommendations for us? This is something that's going to be part of our annual process, looking at our data, assessing where we are, identifying disparities, seeking input from the community. So if there are any recommendations that or questions that come up that we can incorporate into next year's assessment, that's something that we would love to do.
Hi, I'm Heather. Can you hear me? I have
Yes.
okay, great. I am an intern here at Via Mexicana and enjoying it. This task force is a wonderful piece. This is the first time I've worked with the Latino population. My mental health is my background, but I worked with an organization in Colorado for a while, and we called it the Sun Bus, and we would do tours around Tennessee, New Mexico for skin cancer. Are you guys going to add that to this to the population here, since a lot of them go back and forth and it's pretty prevalent down there?
Yeah, I mean, we have the list of measures will continue to expand. So these are the measures that we've started with based on the data that we had, and also some other priorities that we knew already were priority areas for some other departments within the organization, like population health. But you know, it is possible that if skin cancer is identified as, or screen cancer screenings are identified as a potential area for investigation, that we could potentially add that based on data that we have.
From the data, I understand how you gathered the data, but is there a particular formula or method that you used to what you targeted to investigate?
In this case, the measure, you mean like the measures that we looked at, right? In this case, the measures were based on data that we already look at for some other quality assessment purposes. We also had priorities that were already identified for our population health group that does like targeted communications with members around chronic disease management, around screenings. So this year, what we started with was our strategy was to look at, okay, what is being looked at already, and can we provide this additional layer of insight by looking at the data by race and by ethnicity. But we will be expanding our measure set in the coming assessment. So that's something that we would consider. Dawn, anything to add here about priority measures?
No, I think you did a great job. I mean, we use pretty standardized measures, and the reason for that is we want to allow ourselves to benchmark, and so not only benchmark against other populations internally, but other organizations. So you think about the health departments tracking information too, and all of that. So that sort of was our strategy. But yeah, as Emmett shared, we're hoping to expand our measure set wide and long, and hearing from you, and this is exactly what we're hoping for in these conversations. Hearing from you, would love to hear not only sort of additional measures we might consider, like skin cancer screening or others, but also sort of what you're hearing from the community about where the community is and what needs, especially the community is interested in what their concerns are. So yeah, any other helpful insights about these health disparities, particularly if you take colorectal cancer screening as example? What are some of, in working with the communities you work with, what are some of the anecdotes, etc., case studies you're hearing and can pass along for us would be great.
Mhm. Again, since I'm an intern here and specifically working directly and only with the Latino community, of course, you can imagine New Mexico and Arizona, Texas has that, but we also use the whole population. But but any population, it's gaining their trust, and so that they know. But I don't really think a whole lot of people in any culture really doesn't understand about like colon cancer and the preventive measure. Definitely mental health is behind the ball at all because it's not been addressed for so long. There's such a stigma around everything about it. And I just think like community events and getting people involved and comfortable with speaking about it, being around the initiative of it as a whole, because the initiative is kind of like a person and they're building the relationship with the person, if that makes sense.
It makes perfect sense. So I'd love to hear too from anyone sort of, I think you bring up such a good point, Heather, and how are y'all building these, or how would you recommend for us to start building these relationships? And I hear community events. Are there particular ones within the region, within North Carolina, that you share? And Gilda, I see you nodding your head, so didn't know if one had for your mind of in directions you can point to us.
Again, I can't speak specifically for the Mexican, but just the events that they have here that's already planned, even though it may not be geared specifically towards Blue Cross Blue Shield's initiative.
Right, sure.
Blue Cross, your initiative is to help this community and to make them well and to bring good health and prosperity and all around the outlook on healthcare as a whole, so you can lower cost and raise quality of life. Is that correct? I mean, is that a correct general statement?
Yeah.
I would say jump into any type of thing where you can so you can build a relationship with people. You can put a face. You can put a face that you can trust. And just always, if you say you're going to do something, follow through with it. That's the biggest thing, and just be inviting to them. And again, that goes along with every population. But
sure.
what I've experienced is that as well here. That's my little take.
No, that's great. Can y'all share specific ones, maybe from the organizations that you're working with, or love to hear some other thoughts as well?
This is Juvencio. I'm with the Association of Mexicans in North Carolina. Emily, thank you so much for your presentation. And Leo, thank you so much for bringing this to this task force. One of the things that I know we don't have much time here, but one of the things that I would love to have Leo, Eminette, and Don is sit down with you and talk about what we have done in the last 3 years, looking at health equity within the Latino community. We just developed a report that we're going to present this week on our equity conference that's going to happen in Charlotte. But this is one of the things that we have found. I mean, all of the information that you shared with us is something that we have seen. But I think as you, Eminette, you were talking about opportunities. And I see opportunities in different levels, different spaces, and different regions. The health in the state of North Carolina is we grown so much after the pandemic. The North Carolina is way behind in terms about addressing equity across the board. But by seeing a corporation like Blue Cross Blue Shield taking the lead and identifying there's some challenges, but also some opportunities to low this disease within the community that we serve, but also how do we come out with some good strategies to address the needs in a long-term plan, And so I will invite you and get Marlene to schedule a meeting with us and show to you and also give you some details and some strategies I mean, one strategy that I think it really needs happens in the state of North Carolina and this across the state. North Carolina is what 80 to 90 counties in rural areas, so there's a challenge there, and a lot of people doesn't have access to health care like everybody does in urban counties. And then when they will be talking about the income of average citizen that we're talking about here is less than $20,000. So there's so many layers of issues that this community faces that happens within every single day. So thank you again for the presentation, and I will look forward to have a conversation with you more deep and to see how we can help you strategize these actions.
Juvencio, can I ask you a question, and maybe someone else on the call may answer as well? Because one of the interesting things about the presentation today, it was statistics about people who have access to health insurance. So I know in our community, sometimes we focus on those that don't have access to health insurance, but these are folks that do have access to health insurance who aren't taking advantage of those resources that are available to them. Is there anything that we can do or share information within the community on how to take advantage of some of these benefits? Because we do see some of these health disparities, and if it can be solved by just as simply, I have insurance, I can go to the doctor and get this taken care of, I think that'll help our community as a whole.
Yeah, and I think the other thing, Leo, I think one thing is how these corporations are socially responsible with the employers in terms of educating about what they have in their hands. You know, I mean, I do remember when I used to work for a public agency, I used to have Blue Cross Blue Shield insurance, but you know, I don't remember but 2-3 times, you know, that my boss or the corporation that I was working with had a workshop and about what it was the benefits. I mean, you sit down with HRs and HR will say, hey, this, this, and this, but that's it. And then you have to kind of figure it out yourself how this plan works, you know? And I don't think it's every single corporation. The other question that, you know, that comes here, how big of those corporations are insuring these individuals? What is the age of these individuals, then the workforce with these corporations? You know, how long have you lived in the United States? Because those factors really has a lot to do, you know? For somebody, they just been enrolled for the insurance for the first time, and heck, I had to because I work for so-and-so, you know? And not because it's what I have to, but you know, those different things, I think we have to be educated about it.
And pulling on that thread just a little bit, and a little bit about what's going on in chat, and Gilda was talking about education, and Leo summing it up nicely with the understanding the benefits. We certainly heard that as well from our focus groups, but want to also pull that thread and say, you know, where would be the most appropriate place to try to connect with the community if we were to host culturally appropriate education sessions on how to use your insurance? And are there, you know, community-based organizations throughout the state that would be a better place? Are there work sites that potentially would be a better place? And just from the community lens, what would be a non-threatening or you know, appropriate place to have we could provide the education, and we could get it even to a place where we'd hope it could be at a level to be understood, and with all the things that we've heard from focus groups, et cetera. But how to start engaging the community, I think, is where we would really could use some assistance. But I hear a deeper talk would definitely be warranted. So educate the community, Facebook Lives, YouTube, in-person meetings. It's so here's a perfect example in the conversations we have and talking about the access, and pulling on that 80 to 90% are living in rural areas, right? And so I think we automatically in industry goes, well, to think about access, we could potentially provide telehealth. Well, not everybody to this point, not everyone's tech savvy, not everyone has phones, not everybody's comfortable using phones, certainly not talking about your health issues on phones. So thinking about that and the community, is there a natural community gathering place or spot that y'all would recommend to start thinking about, or even area within the state, you know, because certainly we know everyone is spread across the state.
I was about to type the question in the chat, but and this is more to the larger group. Are there any organizations that we can or should be connecting with to help us host convenings, right? So who are those community-based organizations that are working on the ground where we can meet people where they are? Because I think that's the important part, right? That we meet people where they are. I think another great point that I think Juvencio was tugging at was maybe those employers, right? How can we help provide education to some employers to provide opportunities for the folks that are working there? I mean, if you're going to have sick employees, they're not going to show up to work. So why don't we, maybe there's opportunities to have some sort of education there with the employers, and maybe work it from that angle. I will share something from the community engagement side and things that we've done in past years. Sometimes being out in communities like at festivals and stuff like that, people want to have a good time and they don't want to hear about education always. And I hope some folks can back me up on some of this if you've heard that or if you've had different experiences. But when we've been out there and we've tried to provide information, it's more of like a just quick grab and go instead of actually listening to the education or the information that we have.
From my experience, what I've had, it is if you just say, hey, come here and let's talk about colon rectal cancer or melanoma or anything like that, or mental health, very taboo. Not too many people are going to come. But if you do have an event and add this into it, if you speak with enthusiasm and passion about for that person and that the initiative to fix this and help them, the more passion you have and a feeling that you put behind it for trust and follow through, I think that will make a difference. I mean, you can't just hand somebody a pamphlet and let them read it because it'll just sit in their car. I mean, for me anyway, it's just the passion in them for them to understand the correlation behind it. And for the ones in the businesses, when you talk with them, that HR person is not always the greatest liaison between you guys. And the red tape and the fine print can really be upsetting. And if you're already confused a little bit, that fear of continually being confused and you're letting your boss or your company know that you're confused is going to prevent you from asking more questions and going further with that. So I don't know how with this new engagement piece, how that would work out, because I know you can't just hold everybody's hand all the way through, but I would think having more of a pyramid of help that can maybe steps out the side of that. Plus too, the HR does not read your claims. They don't know unless it's FMLA. And so they might not want their employer to know. So I feel like there should be an outside person who can speak to that.
Eminette, and down on this data, a lot of these individuals that participate in this, or what you found, most of those individuals go to community health centers, health departments, or just in general? Because for community engagement and outreach, I think the local community health centers will be one partner to kind of help bring the community together, because they're in the community every single day. And then probably there will be one avenue to go about community engagement and outreach and educate the community about the insurance plans that you have and how they're taking care of their health. And the other thing is bringing you into community settings where we talk about health issues, education issues, just in general, and open that for you to kind of be a platform for you to leverage about what you're working on. And then, we can connect you with other community-based organizations in the state, so you can do the same. Like, I think what Pedro is talking about, we are hosting a community event in July that we would like for you to, Leo, somebody from your team to come to this meeting, because it's targeted to families But it's not exclusive just for education. We can integrate health within the same framework.
Wenchi, I think someone from the county engagement team may be there for that. Gray, I don't know if you're still on the call. We had she might have dropped. Oh, Gray,
I'm
you're
still
you're
here.
on, yeah.
Oh, yeah, y'all. Sorry, I've lost my voice, but I'm still here. We are doing a event on July 16th. I think that's right, Vivencia, where we'll have pastors in the eastern part of the state and actually statewide that are coming in, kind of having a listening session as well, where I'd love to have this information accessible, but we can talk about that internally.
I did want to add something. So like similar to what we do, but having like your own Blue Cross NC event for the community, having activities for the kids. Based on the data, I did see that you were able to locate which areas and regions were less using those benefits. So maybe focusing on those areas, having activities for the kids, but during like intermissions, having someone go up to the podium, speak on the educational part, that would get their attention. Having free stuff like free incentives, things like that would help. But it's been, I mean, the survey and the data that you collected is very useful. So I definitely think using that and seeing what, like the counties that need more help, and doing those community events. I'm from a small town, and they do lots of like at the farmers market, things like that, community events. So like settings like that where the community's already there would definitely help out to bring that education out and share it with everybody.
That's great. That's great.
Sorry, and someone had mentioned, I think, about having YouTube and videos on Facebook and everything. I know this is a new initiative, but maybe if someone from your organization, someone from Mexicana and everybody, like maybe picked a topic and for 7 minutes did a little video discussion about it and posted it on maybe your site or our site that people could go and look at individually and be able to hear and digest and think about questions that they had. Might be and something short, not short and sweet, but something directly to a particular piece that they could understand to be able to think about questions that they would have when they are face to face. That's just an idea.
That's great. And I know we're getting close to time and wondering, I definitely would love to have that deeper dive with Huvija. Leo, would that be something we could coordinate through you? Okay, fantastic.
I can help set that up.
Well, thank you, Blue Cross NC, and thank you, Eminent, for the great presentation. We really appreciate it. We loved having you on. I hope it was helpful for you guys to be able to collect a little bit of information. And then we'll share this if it's possible with the members that weren't able to join, and hopefully we can get some feedback from them as well, and we can share that with you guys. So moving on, I know we have a couple of minutes left. I did want to share our upcoming events. So we do have a Men's Health Awareness Month meeting on June 18th from 11 to 12. Our offices will be closed June 19th for the holiday. We will have our second Men's Health Awareness meeting on June 26th from 6 to 7. I think this one will be in Spanish. And then on July 4th, we will be closed. Our Consulado Week in Wilson County will be July 8th through the 12th. If you would like to register to have a table, please contact Bianca Perez. Her email is on the screen, but we will also share it in the chat and as well as on the newsletter. And lastly, our next food drive will be July 12th from 4 to 6 in Greenville. And this week, as Juvencio mentioned, we will be in Charlotte on this Friday from 9 to 2 p.m. There possibly, I don't know, but I can confirm with Elizabeth some spots available if you would like to join us that day. It's going to be our North Carolina Latino Agenda Initiative addressing health equity across North Carolina. And yeah, I think that's all we have for today. Thank you for joining us. If there's any updates that you guys would like to share, what's 12, please be sure to email that to us, and any flyers that you guys have so we can share with our newsletter. And with that, I would like to thank you guys for joining us today, and have a great week. Thank you, everyone.
Thank you.
Thank you. Great job.